Hi everybody, it's Adam with HeartValveSurgery.com, and we're at the American Association for Thoracic Surgery Conference in Chicago, Illinois. I'm thrilled to be joined by Dr. Marc Gillinov, who is the chairman of cardiac surgery at the Cleveland Clinic. Dr. Gillinov, it is great to see you again, and thanks for being with me today.
Thank you.
Yeah, so we're here at AATS and we're learning a lot. I also know when it comes to research and valvular disease, you've been doing it for decades. And I just saw a new research you and your team put out called Patient Selection in Robotic Mitral Valve Surgery. Can you share with all the patients in our community, what did you find in this research?
We found that we can use the surgical robot on more and more people who have mitral valve problems. It used to be you had to have a very specific profile or set of criteria to use the surgical robot. And now we've learned enough and done thousands of operations such that we can extend it, meaning we can take the surgical robot, make a little incision, and what can we do now that's different? We can repair valves that have calcium in them, we can replace valves, we can do reoperations, and for people with mitral valve prolapse, which means the valve's floppy and leaks, we can almost always do the procedure robotically. And in fact, we've extended the indication so much that we just bought at Cleveland Clinic another surgical robot, so that now we have 2 full-time robots just for cardiac surgery, and they're in use all the time. And to me, it's really amazing to make rounds and see a bunch of people with little incisions who are going home in 3 or 4 days.
Yeah, and I've got to ask you a follow-up, because a lot of our patients with mitral valve disease have atrial fibrillation. Can you also use the robot to address that condition during a robotic mitral valve procedure?
That's a great question, and it gets to the topic. Yes, we have extended our ability to do all kinds of operations with the robot, and we can now do an extremely effective maze procedure or ablation for atrial fibrillation with the robot. It took a while to figure out which are the exact techniques and the precise tools to use, but we've got it.
Fantastic. Well, Dr. Gillinov, on behalf of all the patients out there, thanks for everything you and your team are doing at the Cleveland Clinic. Thanks for being with me today.
Thank you.
Hi, everybody. It's Adam. I hope you enjoyed that video. And don't forget, you can always subscribe to our YouTube channel, watch the next 2 educational videos coming up on your screen, or click the blue button to visit HeartValveSurgery.com.